Hi, I'm Andrea Harmon with the Elder Law Firm, and I'm here with Tiffany Adams and Lisa Hart with CareSouth and Encompass Company. Hey ladies, thank you for coming today.
Thanks for having us.
So, tell me a little bit about CareSouth and what they offer here for the greater Greensboro area.
We are CareSouth, an Encompass company, and we provide registered nurses, physical therapists, occupational therapists, and speech therapists, as well as a medical social worker for individuals in their home. We work primarily with their primary care physician, who gives us an order for the services, and we go out into their home and provide those services, and our goal is to keep them as independent as possible for as long as possible.
Okay. And what areas do you service? Is it just the Greensboro area, or?
We cover the whole Piedmont Triad, so we actually go up to up to the northern border of North Carolina.
Okay.
We go down to Pinehurst, down to that area, Troy, down to Chatham County, Pittsboro, Siler City, and then over to Mebane. From the Greensboro area, from the Winston-Salem area, we cover all the Triad areas out there.
So you have
all
a
the counties.
large area.
A lot of counties. And then in addition, in North Carolina, we also have the Asheville area, Asheville, Marion, and Rutherfordton offices. So we have a lot of the state is covered.
That's great.
We actually have 3 branches, one in Greensboro, one located in Asheboro, and one in Lexington. So we can service a pretty large area.
Most definitely. And when you're doing services, do you do some of the complex services like wound care? What are some of the nursing services that you provide, and maybe even therapy services?
We do cover wound care for nursing services. A lot of home health is actually educating the patient about the disease process and what's going on, trying to help them learn to live with the disease, trying to help them to get better, monitoring them. So that's something that people don't really think about, is that, educate them about what to do. Medication management is a big thing with every program that we have. We have a lot of different programs with disease booklets, disease education manuals that help the patient understand why we're trying to get them to do what we need them to do, why the doctor is asking them to learn how to do this or to learn how to count carbs and things like that for diabetics.
That's good.
So,
and I was just going to mention, a couple of examples of things that we've done in the past. And, sometimes people don't think about it, but, for example, a Parkinson's patient has tremors a lot of times. And for an example, they're maybe supposed to take a half a pill a day, and we go in and find a Parkinson's patient taking 1 pill every other day. They don't realize that it can be a simple call to the pharmacist and asking them when they fill the prescription to cut it in half. That way they're not sitting there with a knife in the kitchen trying to cut a pill in half. So those are some simple things that our nurses can go in and educate a patient about.
That's great.
Or like a COPD patient that's not able to go to the mailbox anymore, something simple to get their mail because they just, out of breath, they're exhausted, they can't do it. So it's simple things that a nurse and a physical therapist can go into their home and teach them how to conserve their energy, to watch their breathing, to be able to do those simple things, to be able to stay at home and live a healthier quality of life.
That's great.
yeah. A lot of it is about resources, finding them those resources for all those things.
That's wonderful. So you connect them to what they need.
And in addition to that, there's the hands-on, like I said, the wound care, the teaching them how to do an insulin shot, those kind of things.
Now, if someone wanted to start these services, what's the best way to initiate them?
Really, it's quite simple, and an individual has 2 options. The first option, they can actually contact us directly as representatives for CareSouth and Encompass Company. They can contact our office as well. What we do at that juncture is we actually contact their primary care physician and see if the doctor is in agreement with home health services for the patient. Their other option is actually talking to their doctor and just letting them know that they're interested in our services and just ask the doctor to send an order to us.
Okay.
So really, we have to have doctor's orders, and so we can actually help facilitate that, or they can facilitate that by contacting their doctor.
So it's not very complicated then.
Not at all.
Okay.
Not at all.
Do you have certain payer sources that you accept with your agency?
We do. We're contracted with Humana, of course, Medicare, traditional Medicare, Medicaid, Cigna Health Spring, Health Team Advantage.
So quite a few.
Yeah.
They
That's
are.
great.
And that's actually sometimes can be a complicated question because we take specific policies within a group of insurance. So we always encourage people to call us and ask. It's quite simple for us to find out if it's one that will pay. And I'll expound on Lisa. Medicare, traditional Medicare with the red, white, and blue card covers our service 100%. So there's actually no out-of-pocket expense on behalf of the patient to receive our services.
And that's great for the
It
client.
is. It is.
Was there anything specific that you would like to talk about that your company does that's really special or sets them apart from other agencies?
Our motto is a better way to care. And there's several ways that we do that. One is putting employees in place who really care about what they're doing. And that starts from the very top. April Anthony is our CEO, and she's awesome. And the feeling that you get in the company is that everyone does care about you, about the employees, about the patients, and you really, really see that at the company foundation. There's also a program called Encompass Cares, and that is a program where employees can have a salary, on your paycheck, you can have a regular deduction to where you donate to charity organizations either that the company, helps with either locally, nationally, or internationally, and you can also take medical mission trips. So it's great. They really care about what they're doing, and they want to also give back.
So that's where the name CareSouth comes from. It's from caring.
It is from, got a long background of caring, and then being recently merged with Encompass out of Dallas, Texas, has really taken us. I've had someone say that Encompass is CareSouth on steroids.
That's
so
great.
For us, it's great because we were already well known for being very caring, and now it's even more so.
That's wonderful.
So we look forward to a great.
That's great. Well, it sounds like the clients have a lot of resources available to them using your agency.
Well, yeah, we have not just the nursing, but the physical therapists, the occupational therapists. We have speech therapists that deal with not only how to swallow, but also with cognition issues. We have a medical social worker who's awesome. She's really great. And we also have a home health aide that we use when in conjunction with trying to help someone make it through a little longer to be able to go into a community for further care, or learn how, in addition to working with occupational therapy, learn how to do their activities of daily living now that something medically has changed with them.
That sounds great. Well, thank you very much. This has been very informative, and I've enjoyed hearing what CareSouth and Encompass Company has to offer. So,
Thank you for having us.
Thank you.
thank you. This is Andrea Harmon with the Elder Law Firm. Thank you for tuning into this segment.